Cervical cancer starts in the cells lining the cervix, the lower part of the uterus that connects to the vagina. Early detection through regular screenings can significantly improve outcomes. Here's what you need to know about the signs and risk factors of cervical cancer. Signs of cervical cancer. Cervical cancer often has no symptoms in its early stages, but as it progresses, you might notice unusual vaginal bleeding, bleeding between periods, bleeding after sexual intercourse, bleeding after menopause, unusual vaginal discharge, watery, pink, or foul-smelling discharge, pelvic pain, pain in the lower abdomen or pelvis, unrelated to menstrual cycle, pain during intercourse, discomfort or pain during sexual activity, changes in menstrual cycle, heavier or longer menstrual periods, urinary symptoms, increased frequency or urgency of urination, pain during urination. Risk factors for cervical cancer. Human papillomavirus, HPV, infection. The most significant risk factor. HPV is a sexually transmitted infection, and certain strains are linked to cervical cancer. Smoking increases the risk of cervical cancer, especially in women with HPV. Weakened immune system. Conditions like HIV, AIDS, or medications that suppress the immune system. Chlamydia infection, a common sexually transmitted infection that may increase the risk. Diet and weight. Poor diet and being overweight can contribute to an increased risk. Long-term use of oral contraceptives. Using birth control pills for 5 or more years. Multiple full-term pregnancies. Having 3 or more full-term pregnancies. Young age at first full-term pregnancy. Having a full-term pregnancy before age 17. Family history. Having a mother or sister who had cervical cancer.